Very good evening, ladies and gentlemen. I'm here to present my study which I've done for the past 4 months. I'm a finishing master graduate in intelligent systems. I had an opportunity to work at National Institute of Mental Health and Neurosciences. It is a deemed university for neurosciences and mental health in Bangalore, India. What I did in the autonomic research lab is I had the data of alcoholics before the treatment of yoga, and I waited for the data after the treatment. So I'm just giving you a basic overview so that you will have an idea before I run through the presentation. I had those two of the data, and I helped the doctors get results on the 4 nonlinear parameters based on HRV, and I'll let you know in the future. Okay, heart rate variability is a non-invasive method estimate cardiovascular autonomic regulation. Several authors have reported abnormal HRV measures in alcoholics. Yoga therapy is known to modulate autonomic function in health and disease. Nonlinear measures of HRV are more robust to capture alterations in physiological signal. So basically, you will probably know about HRV, heart rate variability, which is one of the biomarkers for cardiovascular health and the other inborn and external diseases of man. Particularly, entropy measures provide information about the complexity and regularity of non-stationary signals. We investigated the influence of yoga therapy on nonlinear measures of HRV in alcoholics. That's what we did on the prior side. So coming to the yoga therapy, a small introduction. Yoga is about 5,000 years old. It was founded in India. The word yoga means yoke or unity, translated from Sanskrit, which is the prior and the first language in India. It also means discipline and effort. A small history is that yoga is a profound system of holistic health which comprises the control, or rather keeping a balance of body and mind. It was first put into written form as Yoga Sutras by Patanjali Maharshi. Maharshi means out of respect, we keep a person at that level, and the statue of Patanjali is what you can see. Yoga requires you to make an effort to unify your body and mind. You do this by concentrating your awareness on your physical body through breathing and postures. That's one of the yoga to follow. I'll tell you the other methods. Yoga is an ancient Indian science and a way of life, a method to achieve highest possible functional harmony between body and mind. Practice of yoga leads to inner evolution and total transformation of individual consciousness. See, yoga will have a kind of physical impact on betterment and also of spiritual level. So it brings you to positivity on both ways. Meditation is a part of yoga. Meditation is a technique in which the meditator seeks not only to reach a deep state of relaxation, but to quiet the mind of thoughts which will give you peace. Meditation seeks a state of enlightenment, of freedom from the tyranny of our worries. As I was saying, the types of yoga. There can be different paths or margas of yoga that can be taken in order to reunite with the divine energy. An active person can realize his divinity through work and duty, and this is known as karma yoga. Basically, karma yoga is nothing different. Doing your duty with a sense of devotion towards that is karma yoga. And a religious person, through devotion, you offer yourself to God, a believer, and focus on that. A meditative or a reflective person, through Raja Yoga, he follows certain exquisite methods by following some techniques under some guru, and that is Raja Yoga. And a simple one, that is Hatha Yoga, the physical path, using the body through asana and pranayama, which the patients have undergone in this study, to control the mind and senses. Ashtanga of yoga includes yama, the do nots, that's universal morality, niyama, the rules like personal observances, asanas and pranayama. These are the 2 things that I have followed, that's why it's highlighted. Pratyahara, dharana, dhyana and samadhi. Samadhi is union with design. These are the Ashtanga of yoga. Now coming to the parameters that we took into picture when we analyzed the alcoholics. HRV, I have gone through many definitions of heart rate variability, and what I understood, it's my personal definition, is the measure of non-linearity of the heart. The heart behaves every second differently, in the sense that the RR interval changes, and to observe that and interpret, extract information from that is HRV, is what I have understood. Mathematician compares the most diverse phenomena and discovers the secret analogies that unite them, and that's what I'm trying to do. Heart rate variability, analysis of the instantaneous, that is beat to beat changes in the heart rate. Heart rate is not a constant entity. Ultimate aim of the system is to maintain milieu interior, as suggested by one of the primordial medicine. And this is what I was talking about. The 0.859 and 0.793 is randomized, and there is no regular beat to beat difference. So the way the heart rate changes is heart rate variability. This is the ECG signal and the RR intervals very pictorially represented. History of HRV goes back to Ayurvedic medicine, especially Nadi Vignan, 1000 BC, as well as medical diagnostic systems in China, gave importance to beat-to-beat rhythms of the pulse and heartbeats. Though it was not physically visible or any ailment was seen, they observed that the heart was, the key to other systems as well. Hales in 1773 observed the respiratory pattern in BP and pulse of a horse. Ludwig Traub, Donders, and Herring and the others explained the RSA. Hahn in 1958 treated HRV as a global index of fetal distress. Wolff in 1967 viewed HRV as a reflecting brain-vagal heart communication. HRV, a dependent variable, was influenced by cognitive and metabolic processes by Orbist in 1981. Involvement of HRV in various cardiological and neuropsychiatric disorders began since then in the late 1980s. Now, how to measure HRV is we consider an artifact-free lead-to ECG in a standard lab conditions after 15 minutes of supine test, sampling rate of 1 gigahertz, amplitude resolution of 12 bits ADC, a duration of 5 minutes, band pass filter of 0.5 to 60 hertz, so rather 60 because of the current frequency, current in the sense electric frequency of the household, the storing the data, and the analysis software. So these are the different measures, or rather steps, for measuring the HRV. And this is what we get after we do that. I'll go through the step process and the parameters that we observe from this graph soon. Now, for this study, the inclusion criteria for the alcoholics, we considered males between 20 years and 60 years, satisfying the DSM-4 criteria for alcohol dependence syndrome, willing to undergo inpatient treatment for more than 3 weeks at the hospital. Exclusion criteria having significant physical illness like cardiac illness, because our main parameter was treating HRV and we didn't want it to got interfered by other illness other than him being alcoholic addict itself. And high suicidal risk, physical disabled person, and presence of mental retardation and other such things were ignored, or rather taken off. 15 minutes of resting lead to ECG of 19 alcoholic patients admitted for de-addiction were collected before and after the 3-week yoga therapy. Nonlinear measures of HRV were computed using Cubios software. Cubios is a freely available open source software for ECG, hence for HRV analysis, and it is developed by one of the premium universities. In particular, the Shannon entropy, approximate entropy, sample entropy, and correlation dimension with DFA were estimated as per the standard algorithm. These are the parameters in case of statistical processing and chaos theory, information theory. These are the parameters that you see in a signal, basically any signal. And when you see the signals, when you see these parameters in ECG, few of the parameters were very significant with alcoholics, signals of alcoholics before and after, and I have the results. The timeline of treatment was first week was detoxification, second and third week was yoga training. The yoga therapy that we followed was yoga for 40 minutes and pranayama for 20 minutes a day. The yoga asanas, the physical postures that the patients went through, is Makarasana, Shalabhasana, Bhujangasana, Dhanurasana and Surya Namaskara. The pranayama techniques were Ujjayi pranayama, Bastrika pranayama and Nadi Shodhana pranayama. These are very few, not easy but very intense or useful of the yoga and pranayama techniques out of the many available, and it is very effective. Coming to the analysis of the signals, statistical analysis, we did a paired sample t-test to assess the difference between pre and post treatment of the signals and the nonlinear HRV measure values, which are Shannon entropy. The Shannon entropy equation provides a way to estimate the average minimum number of bits needed to encode a string of symbols based on the frequency of symbols. Basically, the RR interval, if we give that data to the software, it gives out with Shannon entropy and other entropies. An approximate entropy is a technique used to quantify the amount of regularity and the unpredictability of fluctuations over the time series data. Sample entropy is a modification of the approximate entropy used extensively for assessing the complexity of a physiological time series signal. Because SAMPEN, there are few available softwares. SAMPEN I would have heard, cardiac doctors would have heard about this. Unlike approximate entropy and sample entropy shows good traits such as data length independence and trouble-free implementation. Also, there is a small computational difference. In approximate entropy, the comparison between the template vector and I would have shown the part which is not really necessary, and the rest of vectors also includes comparison with itself. This guarantees that the probabilities are never zero in case of sample entropy. And the last two are the correlation dimension. Correlation dimension is a measure of dimensionality of the space occupied by a set of random points when you plot them, often referred to as a set of fractal dimension. DFA or detrended fluctual analysis is a method for determining the statistical self-affinity of a signal. It is useful for analyzing time series that appear to be long memory processes, like basically diverging correlation time, like power law decaying autocorrelate function, or the 1 by frequency noise. These are the parameters that we analyzed of the nonlinear measures. And this is the data I have got, and the p-value is significant in case of Shannon entropy and sample entropy. It's a pilot study basically. There is no point that I am intending, and seeing from the engineering perspective how I can analyze the signals so that it can visibly show the doctors rather than seeing the patient's physical conditions and his ECG signals. He can go deep into this, and analysis is better. This is the graph showing the pre and post for APEN, and this is the thing for SAMPEN. Conclusion is yoga therapy increases the complexity of HR signal as suggested by entropy measures. Yoga also improves the disrupted autonomic function in alcoholic patients. Further, for better analysis, large-scale randomized control studies are required to confirm the beneficial effects of add-on yoga therapy in direction treatment. And thank you all. I thank the organization for giving me the opportunity to come and present here. I also thank my country government for funding me and sponsoring me, and NIMHANS, National Institute of Mental Sciences, for giving me an opportunity to work there for the data, and other guides present there who are Pratima ma'am and Dr. Satyaprabha, Dr. T.R. Raju, and my guides Dr. Koshi George and Dr. Niranjana Krupa ma'am, and my family members. Thank you everyone.
So now, this is an interesting study because